Hello, this is Dr. David Oliver here from the Freshwell Health Centre. This video is about prediabetes and, more importantly, how you can reverse it. And please remember, this and all our videos are for information only and not medical advice. And do please check with your doctor or nurse before starting any new lifestyle changes if you suffer from any health conditions, eating disorders, pregnant, breastfeeding, or under 18 years old. Also, if you're on medication such as blood pressure medication, making some of the lifestyle choices that we're going to discuss may potentially reduce the need for blood pressure medication and could result in you becoming over-medicated. Anyway, enough of that. What is prediabetes? Most people know that diabetes involves having a raised sugar level in the blood over a long period of time. We see blood sugar on a continuous spectrum, really, from low blood sugar to high blood sugar. The World Health Organization has made a decision as to where on that spectrum you become diagnosed with type 2 diabetes. We use a blood test called the HbA1c level, which measures how sugary the blood has been in the last 3 months. A level of 48 or more on 2 or more occasions is equivalent to a diagnosis of type 2 diabetes. Prediabetes is not quite up to that threshold, but still raised blood sugar. The World Health Organization has agreed a level of 42 as prediabetic. The important thing about prediabetes is that it can progress to type 2 diabetes at a rate of 10% of the population per year. This is why it's so important to take the opportunity of trying to get things under control and potentially reversing it at an early stage. In addition to having an HbA1c of 42 or more, prediabetes can be diagnosed by having an abnormal blood sugar level, blood glucose level, when you've been fasting for 12 hours. In addition, there is something we call a glucose tolerance test, whereby you have the fasting blood test, we give you a sugary drink, and then we repeat the glucose sugar blood test 2 hours later. We tend to do less of that these days and tend to rely much more on the HbA1c level. You may hear expressions such as impaired glucose tolerance or impaired fasting glycemia or non-diabetic hypoglycemia. All of these things mean the same, and it's a little bit confusing, but essentially they mean the same thing, that your blood is sugary, but it's not sugary enough to be called diabetes. There are other terms that we're going to briefly discuss in this video. There is something you may have heard of called metabolic syndrome, which is quite complicated, but essentially what it means is that it's a situation where you tend to keep a lot of fat around your organs. So it's not fat that you can get hold of from the outside, it's organ fat or visceral fat, and there's a big overlap with that with prediabetes and diabetes. Another term we're going to discuss later on is insulin resistance and non-alcoholic fatty liver disease. I tend to think of all of the words on this slide as really having a very similar meaning. There is a big overlap between all these things, as we will discuss. Where does the sugar in the blood come from? Sugar, a lot of people tend to think of sugar as table sugar, which is essentially two molecules together. There's a glucose molecule and a fructose molecule. It's also called sucrose as a combined molecule. This gets broken down and processed by the liver, and the liver releases glucose into the blood. We tend to refer as blood sugar as blood glucose, whereas there are different forms of sugar that come from outside. The fructose can only be processed by the liver, whereas the glucose can be used elsewhere in the body. There are a number of different combinations of single sugars and double sugars. Lots of different natural sugars like honey and fruit also contain sugar, fructose, glucose in various different amounts. And the problem with having too much fruit juice, for example, or particularly sugary drinks, is they're very high in fructose, and the only place that fructose can be metabolized is in your liver, and that puts unnecessary stress on there. Other forms of sugar that we don't tend to think of as sugar because they don't taste so sweet are carbohydrates: pasta, rice, potatoes, bread, cereal. That also gets broken down by the gut into lots of smaller molecules of glucose, and that also goes to the liver and contributes towards the glucose in the blood. Blood sugar needs really tight regulation, because if it goes too high, it can cause problems like it does with type 2 diabetes. The body has a hormone, insulin, which is released when there's high blood sugar levels from the pancreas, and in the presence of insulin, glucose is driven into muscle cells and liver cells and fat cells. Insulin is essentially a fat storage hormone, and the glucose is stored as fat. In an ideal situation, we have in our 8 pints of blood, we have blood sugar or blood glucose, but we only have about a teaspoonful of it in a whole 8 pints of blood, which really isn't very much if you think about it. This is a graph of blood sugar versus time, and you can see how that blue line of blood sugar going up and down is quite nicely controlled within a fairly narrow band. This is what we should aim for. For some people, over the years, they can develop a state of what they call insulin resistance, whereby the body's liver is being bombarded with so much sugar over the years that it starts to become resistant to the effects of insulin as the body is trying to squeeze more and more sugar into fat cells. We start off with a normal amount of sugar going to the liver and nicely controlled blood sugar. Then we start to add more and more other types of sugar, the sucrose from table sugar, so-called natural sugars, and carbohydrates, and slowly over time you can get a buildup of fat in the liver, which is unhealthy as the liver becomes under strain and it starts to struggle to function, and it starts to struggle to be able to control the blood sugar levels. On top of that, if you throw some alcohol and give the liver more stress and more work to do, that can just exacerbate the problem. And eventually you start to build up the organ fat that we were talking about in metabolic syndrome. And not only can your liver become fat, but all your internal organs can as well. And eventually, the more of this that happens, the more that you stress the liver. For some people, but not others, this can result in much higher blood sugar levels. So instead of this situation whereby the blood sugar is nicely controlled like we saw earlier, the blood sugar can end up poorly controlled like this. When the blood sugar is sufficiently poorly controlled, we can end up in a situation with type 2 diabetes. As we said earlier on, 10% of people each year with prediabetes end up with progressing to type 2 diabetes, and this is a really good opportunity to prevent diabetes happening in the first place. Symptoms of diabetes include increased drinking, increased thirst, increased urinating, weight loss, lethargy, numbness. There's quite a number of symptoms. If you have prediabetes and you develop any of these symptoms, you should go and see your doctor as soon as possible. With diabetes, sometimes people need medication to control it. If we can manage to intervene before that happens, so much the better. Complications of diabetes can include increased blood pressure, increased cholesterol. You can end up with damage to the back of the eye and blindness. You can end up having heart disease and heart attacks, increased risk of stroke, increased risk of kidney damage, an increased risk of leg ulcers and nerve damage. All of these things you have an increased risk of if you have type 2 diabetes. Onto the risk factors for prediabetes and type 2 diabetes. No surprise that being overweight, defined as a body mass index of greater than 25, is very much associated with diabetes and type 2 diabetes and pre-diabetes. At the onset of type 2 diabetes, 85% of people are overweight, but interestingly, 15% of people have a normal weight. So it's a little bit more complicated than just looking at weight. It's more about what type of person you are in terms of where you store your fat. People are different. Some people tend to be able to store fat underneath the skin as subcutaneous fat. That's fat that you can kind of actually grip with your hand. We have patients who are severely overweight and don't seem to develop diabetes at all. Some people tend to store their fat as visceral or organ fat. We talked about metabolic syndrome earlier on, where this is a problem. So some people are predisposed to it and some people aren't, and we think it's got much more to do with where the fat is stored. Waist circumference is a much better guide than looking at BMI, and that is quite a good thing to monitor. Age is a significant factor in a risk factor in developing prediabetes and type 2 diabetes. Realistically, it's a long old process of people putting weight on over the years, becoming insulin resistant, and perhaps after that becoming pre-diabetic and then having type 2 diabetes. Sedentary lifestyle, not taking much exercise, can certainly predispose to this as well. Family history of type 2 diabetes and ethnic origin are very much both risk factors for type 2 diabetes. These characteristics, I think, can often determine what type of fat storer you are, whether you're someone who stores fat as subcutaneously or whether under the skin, or whether you store fat amongst your organs as a visceral fat, as we said before. Gestational diabetes, people who develop diabetes sort of temporarily in pregnancy, they're more at risk of getting type 2 diabetes in later life. Some medication like steroids can also predispose you to getting diabetes. Just to recap, type 2 diabetes can take years to develop, from not having diabetes type 2 to moving through to pre-diabetes and then type 2 diabetes. And we see pre-diabetes as a real window of opportunity to be able to reverse this process, to be able to reverse the insulin resistance, and be able to have nice normal blood sugars and minimize the potential for damage to organs that you can get from type 2 diabetes. What can you do about trying to reverse your pre-diabetes? Modifying your diet and consequently losing weight are probably the cornerstone of sorting this out. That's what the rest of this video is mainly going to be about. But it's also important to remember to really minimize your alcohol intake. We do find some people reducing their carbs, but rather forgetting about the alcohol. The less you drink, the easier it is to reverse your pre-diabetes. Taking exercise, not a great weight loss tool in itself, but really good for you, and also will definitely help you reverse your pre-diabetes. Focus on quality of sleep if you can, not always easy, and also anything you can do to avoid stress. These are risk factors in developing pre-diabetes. Remember the slide, a bit of a busy one, regarding insulin resistance and all that pressure the body is putting on the liver. Well, surprise, surprise, what you really need to be doing is reducing the amount of table sugar, added sugar, natural sugar, reducing that down, alcohol if you can, added sugar, and the starchy carbohydrates, and then gradually over time, hopefully, your liver will start to become less fatty and less insulin resistant, and consequently your blood sugar levels should come down nicely. In addition to that, we would hope that the amount of organ fat, visceral fat, that has developed as a consequence of this will also disappear. Onto dietary modification. We're just going to skim over the basics here, but because we have a number of other video modules, we've got a website, a Freshwell low carb website, we've got the Freshwell app and meal planners, which you can go into this in a lot more detail. But so we're going to cover the basics, and we're going to start with processed food. If you can avoid processed food as much as possible, then that's a good start. It's not just junk food that you might get from a fast food outlet, but it's things like ready meals, things in jars, things in packets, things with long lists of ingredients, many of which you may not have heard of. If it's not food as nature intended, have a think as to whether it's processed food, and try to avoid those aisles, of which there are many in the supermarket. Probably no surprise that I'm going to suggest that cutting down table sugar, and table sugar that's added to things like cakes and biscuits and processed food, really needs to be kept to a minimum. Don't forget that supposedly natural sugars from honey and some fruits can also be quite high in sugar. Generally speaking, berries are okay, but things like fruit juices really contain quite a lot of fructose, and that can cause a lot of problems and strain on your liver. So we encourage people to reduce their sugar, and if they're going to have fruit, make sure that they are the less sugary varieties. Snacking's become a part of modern culture. The food industry seems to have managed to convince us that this is the way we should eat. Realistically, this never used to happen in our past, and it's only really quite a recent thing. You don't need to snack between meals. We can really survive quite comfortably between meals, so try to avoid snacks, whether they're supposedly healthy or not. And what you should eat, and we would encourage you to eat real food as nature intended. Lots of above ground non-starchy vegetables, and meat, fish, cheese, eggs, nuts. Some people are surprised to hear that we are okay with people eating food which contains fat. It's our experience that this does not push people's cholesterol up. If anything, because it's helping them improve their insulin resistance, it tends to bring their cholesterol down. We've seen it on so many blood tests before, and we think that this is definitely a way to go, eating food that contains lots of protein and lots of above ground non-starchy vegetables. Try to keep your intake of starchy carbohydrates to a minimum. As we discussed earlier on, the starch molecules are basically long chains of glucose molecules which all get broken down in the gut and absorbed by the gut, and by the time they get to the liver, it's just a lot of glucose sugar molecules that can serve to help overwhelm the liver and cause the problems that we discussed earlier. So things like rice, pasta, bread, potatoes, cereal, that kind of thing, we're not saying don't eat them ever, but if you can really reduce the amount of these that you take, the less you eat, the better. Although you do obviously need to find a way of eating that is sustainable. Once you've been diagnosed with prediabetes, it's well worth having some annual checks. It's recommended that people have the yearly HbA1c blood test to make sure that this hasn't progressed to type 2 diabetes. Also, worth keeping an eye on your cholesterol and blood pressure, which can both be raised with prediabetes and type 2 diabetes. Obviously, the weight as well, and waist circumference, which, as we discussed, is a really good way of monitoring things. We've done some extensive modules. We've got a video module on knowing your numbers, and we've also got an app which you can download here using this QR code. You can or type Freshwell into your App Store or Google Play, and you can download our app, which goes through this in much more details, what the numbers mean in a little bit more detail. So please do have a look at the Freshwell Low Carb website. From there, there's a link to go to the app, and you'll see a picture of the landing page on the app on the left side. And also, Dr. Andrews has written some extensive recipe planners in case you're stuck and you need to have some inspiration as to how you can make these changes. If you want to dive into a little bit more detail, we've got more detail, as I mentioned, on our Freshwell Low Carb website. Another GP has written an excellent pre-diabetes guide, which goes into quite a lot more detail than we do. And the best website in the world for low carb advice and information, we think, is the Diet Doctor website. And there is so much information there if you really want to dive deep. Another GP-led website is the New Forest PCN low carb website, and they've got a great section on pre-diabetes there. Diabetes.co.uk is an excellent resource for finding information about pre-diabetes. The Public Health Collaboration website has got loads of information there too. Also, in association with our local GPs in the Colne Valley Primary Care Network, anyone who lives in those GP catchment areas can sign up for our low carb program, where they can access the video but also have some great one-to-one coaching support. And they can contact the team on the email address shown there, or you can have a look at the Colne Valley PCN low carb website. So do remember, this is a diagnosis of pre-diabetes is a window of opportunity to get in there and do all the life changes necessary to be able to reverse the pre-diabetes and hopefully never develop type 2 diabetes. Hope this helps. Thanks very much for listening. Bye.